We are extremely honored to have with us the founder and director of the Thai Community Development Center, Chancee Martorell. Chancee was born in Thailand and raised in Los Angeles. She studied political science and public law at UCLA, where she received both her BA and MA in urban planning with the specializations in urban regional development and third world development. She also studied humanities at Chiang Mai University in northern Thailand in 1988. Engaged in social activism for the past 35 years, Chancey leads Thai CDC, a nonprofit organization she founded in 1994 in an effort to improve the lives of Thai immigrants through services that promote cultural adjustment and economic self-sufficiency. She is known most notably for her work on over a half dozen major human rights cases involving over 2,000 Thai victims of human trafficking who were discovered working in slave conditions here in Southern California. Her tireless advocacy on behalf of the victims and the success of each case has made her a leading expert and sought-after spokesperson on the serious issue of modern-day slavery. Chancey is a leading practitioner in the field of community development, engaged in ongoing affordable housing development, small business promotion, and neighborhood revitalization projects. Thai CDC, I'm proud to announce, is a two-time endorser of the two true single-payer bills that have been introduced in California. In 2022, it was AB 1400, and as mentioned previously, last year it was AB 2200. Welcome to the show, Chancey. How are you?
Fine, thank you. Thank you for having me. I feel very honored and privileged to be on the show.
How's things been going over at Thai CDC amidst all of this madness that's been going on?
It has been overwhelming, to say the least, and we have been unable to rest or have any respite. Since the wildfires, we've been rendering aid and relief to vulnerable victims who oftentimes gets bypassed because of language barrier or transportation barrier or technology barrier. And then, of course, with the Trump administration taking office, it has become just very difficult to work in this atmosphere of fear and terror. We have people who are just very scared of what could happen to them because half of the people we serve are undocumented. So we've been doing Know Your Rights workshop around the clock and passing out these red cards to help people understand their rights and their right to remain silent should ICE agents approach them. It has been just very, very stressful on our community, and our staff is also feeling the vicarious trauma coming from this reign of terror, I would call it.
Yeah, it's across the board. I think everybody's feeling it. I mean, it's being born here. It's hard for me to imagine what it's like for the immigrant population and especially the undocumented. I know on the morning after the election, I woke up and I got, oh my God, the nightmare of being awake now is worse than when I was sleeping, you know. And
yeah,
the other thing I reflected upon is, you know, I mean, a lot of us have an immigrant legacy. You know, I'm only two generations away from that. You know, when my grandparents on both sides, maternal and paternal grandparents, immigrated in the 1920s. And so I'm very cognizant of like the more recent immigrants that have the same kind of, you know, language barriers and discrimination. It really hasn't really changed, you know, fundamentally, right? And I'm sure glad that we've been able to get to the language translation for those Know Your Rights cards. You know, I have some stories of how the education, the grassroots education that people have been doing across the country has been able to chase ICE out of neighborhoods and things like that. And people, you know, the old saying, knowledge is power. And I think we've been seeing that with the work, but clearly it's a stress, you know, for underfunded, you know, grassroots forces to get the word out to populations who have no idea about, you know, what their legal rights are.
Right. No, exactly. So yes, we've been doing a lot of workshops, a lot of education. We've been going to churches, to other nonprofit service providers, and training people at various settings how to respond should ICE show up at the work site, at a hospital, at a school, at a church, at a healthcare provider, at a housing provider, social service provider, etc. So depending on the setting, because they now are going to sensitive locations like schools and hospitals. They've decided that there's no protection anymore of sensitive locations, which used to be protected because people get sick and should be able to get care, and kids go to school, should be able to go to school, and people have a freedom to worship, should be able to go and worship. But not anymore.
That's just
they,
horrible.
yes, have taken away, the protection of sensitive locations.
California is supposed to be a sanctuary state.
Yes.
LA is supposed to be a sanctuary city.
Correct.
I mean,
we still are.
I mean, how do you see that in terms of like, the benefits of having that declaration as well as the shortcomings in terms of, I guess, how it's enforced as a sanctuary city? Do you have any assessment about that?
Well, fortunately, we are in a sanctuary state, county, and city. And there's some measure of protection there because you have government departments and agencies unwilling to cooperate with immigration enforcement, and law enforcement of these municipalities here in the state and also in the county and city, also not willing to cooperate with ICE enforcement, and not turning people over to ICE, and not turning over any kind of information to ICE. So there's a measure of protection there. And of course, the Trump administration is threatening to withhold federal funding to these municipalities and the whole state and the county and what have you. But Governor Newsom had just gotten millions of dollars appropriated to come to defense of the undocumented. So we have government that's at least sensitive to the undocumented. We have the Immigrant Rights Are Los Angeles coalition that we're part of in the county of LA that is trying to prioritize the county budget on the needs of immigrants because they make up the backbone of the county's economy.
Absolutely.
And then we have a city council that's also trying to protect and defend immigrants. And you have Attorney General of state of California, Attorney General Bonta, who's going to file every lawsuit imaginable against this administration to protect immigrants and the most vulnerable of all as well.
Yeah, I think having Attorney General Bonta is kind of, I look at it as a community win, And
yes,
his family goes back to, I think, connection with the whole Io Hotel fight, back.
Yes, and also the farm workers, Cesar Chavez and the United Farm
Mia has been a really solid ally, right? Heading up
Mhm.
the health committee last year, she really helped advance the bill as far as it went,
Mhm.
So I'm really grateful for both of them. Do you feel like there's enough support existing with specifically with respect to the Thai community and some of the Asian community, undocumented communities?
There needs to be more awareness that while over 70%, I think close to 80% of the undocumented in LA are Latino immigrants. About 16% are Asian immigrants. And so there needs to be more awareness that there is a segment of the Asian immigrant population that's undocumented, and that is at risk of being rounded up and deported. And so we work together as part of AAPI Equity Alliance with all these other AAPI nonprofit social service providers to really educate the media more than anything. We're all aware in all of our different social justice, immigrant rights, civil rights, legal aid organizations, all of those partners have that understanding across the board. But I think the media really does not understand that that there are vulnerable populations, the AAPI community, and have not. LA Times just published an article this weekend that finally brought that to to the reader's attention that AAPI communities are also going to be affected. Once I believe the plan is for ICE to start coming into LA. I mean, they had already come into LA not too long ago, but coming in with force, like shock and awe, starting February 20th. Right. And so we need to be prepared, and we need to make sure that everyone's aware that the AAPI communities will also be targeted, not just the Latino community. And we all need to band together. Both the Latino and AAPI communities need to really band together and really put up a fight and defend the vulnerable in our community. And I've been seeing that. We're crossing and transcending racial and ethnic lines because it's all, about uniting around a common purpose, and that is to defend the vulnerable members of our community and to really ensure that that this kind of travesty not occur, where individuals are not treated as human beings, because no human being is illegal, and that we are given and accorded, everyone's accorded their due process, and are not being terrorized, and families are not being torn apart, and children are able to go to school, and families are able to go to work and earn their living and continue to be the backbone of this economy, and that and people are able to go to the hospital and are able to come forward to report a crime. So what you're going to essentially get is like a class of people driven further underground and in a total state of fear.
A little bit overwhelming, I think, on some level, but on the other hand, like you mentioned, it necessitates a broad, unified response, and it is encouraging to see that type of response happening across the country. I mean, even like in the case of the fires that you were mentioning, and all the outpouring of support and mutual aid that popped up, everywhere. I mean, thousands of people were engaged, and I think that it's the meeting of the moment, challenge that I think we all have to contend with. And I'm really glad that you're here to share some of this background information. But let's get into some of what was promised earlier, some particularities about the Thai community. And of course, all of these things are interrelated, but maybe you could share some of the more details of how, because a lot of people aren't very familiar with the nature of the Thai community, the history of it, or the demographic makeup of it, what sectors that people are working in. Maybe you could share a little bit.
Sure. Now I hear an echo. No, I don't hear an echo. Okay, now I'm good. Okay. So the Thai community, when compared to the other AAPI ethnic immigrant community, is a fairly new community. We started arriving in the United States since the 1950s, and we settled in Los Angeles County. Southern California has become the largest or home to the largest population of Thais abroad outside of Thailand at about 200,000. But within Southern California, they're concentrated mostly in two clusters in the East Hollywood neighborhood of Los Angeles, city of Los Angeles, and then the Northeast San Fernando Valley. And the reason for that is because when Thais first started immigrating here to Southern California, Hollywood was what they knew. They had heard of only Hollywood because there was the Vietnam War, and the U.S. had a military station there in Thailand, and they basically would be watching movies from Hollywood, and so Thais thought. Basically, they didn't understand that they're talking about Hollywood, the movie industry. They actually associated that with the location and thought that was the United States, that Hollywood was the United States. And so that was kind of what imprinted in their minds as the United States, that Hollywood is where they should go to, is the place to go to. And so that's how they arrived then in Hollywood. And they started setting up shop, and businesses started proliferating. And then you needed a workforce. They started coming also as workers who became an integral part of the local economy. But then 50 years ago, when the Thai temple in North Hollywood was built, so that Thais, a growing number of Thais, could have a place to worship, since 95% of them are Theravada Buddhists. They then started purchasing their first home around the temple in North Hollywood, and that expanded to other neighborhoods of the Northeast San Fernando Valley. That included Van Nuys, Orlita, Panorama City, Sun Valley, and so you have that also pocket of Thais. So a lot of workers remain in East Hollywood as a workforce. And then when more workers started arriving, they continued to remain in East Hollywood, residing and working there. But then those who were able to afford to purchase their first home as a first-time homeowner and suburbanized and tried to get a better school for their children, they then would move out of Thai town to that Northeast San Fernando Valley area. And so that's sort of the kind of immigration history of Thais in the U.S. and their demographics a little bit. They are characterized by really socioeconomic characteristics that had changed over time. They've come into this country through three primary waves. The first wave in the 50s were primarily technocrats and very educated Thais who actually came to get further education and knowledge and training, and then went back to Thailand to develop the country as its developing country at the time. Then 65 ushered in a whole new era when Congress passed in the Immigration Nationality Act that opened up the immigration from Latin American countries and from Asian countries. And so Thais took advantage of that and came mostly as students, and some of whom privately funded their own education and worked and studied and ended up actually not being able to afford their education and finishing up. So ended up starting a lot of the businesses you see today. And then starting in the 80s, you began to see a third wave of mass migration because of the industrialization that was occurring rapidly in Thailand and modernization that displaced a lot of the Thai farmers and peasants off their land, and they had to migrate outside of the rural parts of Thailand to urban centers like Bangkok, but then saturated that job market and ended up having to then migrate further outside of Thailand, and then end up ended up here, most of whom came with only up to third grade level of educational attainment and have no English proficiency, and also are either unskilled or semi-skilled. And they're the ones who end up being very vulnerable to the most egregious forms of exploitation in the workplace, and end up either lapsing from their non-immigrant visa that they used to come here into undocumented status, or actually had fallen victim to human trafficking and ended up becoming indentured servants or modern day slaves. And so you have this segment of the Thai population that Thai Community Development Center primarily serves, because they're the most vulnerable, destitute, downtrodden, dispossessed, and very much in need of a wealth of services and resources that they cannot access otherwise due to their limited English proficiency.
And in terms of the type of work that a lot of these undocumented Thai are involved in, it's kind of like obviously manual labor. Like, is it type of manufacturing, including garment work and?
Yes. So initially in the early 90s, a lot of them came to work in garment factories, and those factories were owned by Thai contractors. And then with the proliferation in the 90s of Thai restaurants, because then Thai cuisine became a popular cuisine of choice for many. And
who doesn't love Thai food?
Right. And so then you began to find a concentration of workers in the food establishment and restaurant industry. And then in the mid 2000, you began to see the popularity of Thai massage. And so then Thai spas started popping up, and massage businesses. So then you now see a concentration of Thai masseuse and massage workers. So these are now the two primary industries that Thai workers are concentrated in the food industry, in like the restaurants and grocery stores, and in the massage industry as masseuse. Unfortunately, the garment industry and the manufacturing industry went offshore, because it was cheaper to go offshore for a lot of these manufacturers and retailers, and those contractors then no longer could stay in business. And so then the workers in the garment industry ended up in the restaurant or now in the massage industry.
And I would imagine the unionization rates for Thai workers is really low.
Extremely low, because there are no such thing as unions for massage workers and restaurant workers, period, in general. We try work, of course, with Koreatown Immigrant Workers Alliance, right, who have been campaigning to unionize restaurant workers. So yes, so we would, be totally, up to working together with them and start educating workers about just the value of collective bargaining and joining a union and being able to demand better pay. And what we end up doing, because we also have a Thai worker center, is doing a lot of education around rights and minimum wage and overtime compensation and what to do if you report abuses and wage and hour violations and are retaliated against. And then we have a legal unit that actually defend workers and file for back wage claims on behalf of workers.
That's great. So thank you for sharing all that extensive. I feel like I got a Thai American, Asian American Studies class 101 there. Thank you for that.
Well, I actually created the Thai American Experience
That's right.
at UCLA back in the early 90s.
That's right, you did. So with all of this, knowing all of this, how about sharing how it probably wasn't a difficult decision to make to endorse the CalCare efforts? in
Oh, not at
2022?
all. Not at all.
Faster.
We definitely need a single payer system for healthcare. If everyone, you know, is able to access healthcare, it should be a universal healthcare system. We are the wealthiest industrialized country in the world, and yet we cannot provide healthcare for the whole country, unlike other Western industrialized countries. It just it doesn't make any sense at all. Yeah, and I think it's because the healthcare industry has been hijacked and became a for-profit industry where CEOs are making gobs of money in the millions and millions of dollars who are not medical professionals, and doctors have no say in your care at all, but these CEOs do. And yeah, it's just been privatized and meant for profit, not for people. And as a community organization that serves people who are medically indigent and cannot access healthcare, it just behooves us to support a single payer system.
What are some of the top healthcare needs, disparities, as you will, faced by the Thai community? You mentioned, of course, language barriers, but are there particular medical conditions that would be addressed by having a free healthcare system available to the Thai community?
Yeah, no, absolutely. We have done a study on the state of health of Thai immigrants, and it was our quote unquote white paper, and it was called Healthcare on the Margins, the Precarious State of Health for Thai Immigrants. And we found that 69% are medically indigent or without health insurance. And we found that the second leading cause of death was peptic ulcer, which no one should die from because, unfortunately, it's compounded by a lot of chronic diseases that go untreated because they don't know where to go for treatment and they can't afford treatment. And we found that the leading chronic diseases that Thai immigrants who's are low incomes suffer from diabetes and from high cholesterol and from hypertension and so these are the chronic illnesses that we found, and we have found that they are not only unable to access healthcare because of language barrier, but because they have no access to sometimes like fresh produce. And so there's like food insecurity that's compounding that as well. And then there's the stress and tension associated with the acculturation process that really leaves no room for them to attend to their own individual personal health or the health of their family, because they're always trying to eke out a survival and spend 24/7 working to put food on the table, because these are low-wage workers, a lot of them, the people we serve, and making time for healthcare is a luxury. There's no time to go to the dentist, to go get your physical. So what ends up happening is they only see a doctor in a case of emergencies. Like you have to be like nearly bleeding to death before you go to doctor, and then you end up in the emergency room or urgent care. And if you don't have insurance, that's going to be a huge bill that you can't even pay. So they try to avoid it at all costs because they know it's going to cost them if they have no health insurance, right? And of course, we work very closely with these low-cost nonprofit health clinics like Asian Pacific Healthcare Venture. And a lot of Thais are able to get help with enrollment to Medi-Cal and be able to get some healthcare there, like clinical care. But when it comes to emergency, that's harder. When it comes to real like life and death or serious, like if someone suffers a stroke and needs to be hospitalized, or someone ends up having to go to the ICU. So that's why we make prevention, education, prevention really important. And that's why we do health fairs. We have another health fair coming up on March 1st at the Thai Temple.
Yeah, that's great. Okay. I think that the challenges are so extensive for the Thai community with that low insurance rate. I mean, I'm sure probably because of the language barrier too, just navigating how to go, applying for insurance that exists, such as it is with Medi-Cal or coverage.
Oh yeah, no, they would never be able to navigate without our assistance. So we do all the hand-holding and navigation, because now everything's in this portal. So there's not only just the language barrier, there's technology barrier. And so, yeah, so we basically handhold everyone through the process in enrolling onto all kinds of public benefits, Medi-Cal being one of them. And luckily for the undocumented, for a while we had the My Health LA for the undocumented, which we helped people enroll in. Now it's just Medi-Cal. And we still help them enroll because, yeah, they don't understand that they are eligible. And then once they understand that, how is it that they actually can get on it? So that's when we do the enrollment. And then, of course, all the reporting, sometimes they have to come to us because they have to always report, any changes to their income and all of that. So we have to follow up on their behalf as well. And so it's long-term case management that we provide, and that language barrier is just continues. We still need to look out for each person and make sure that they are on top of it all, and we help stay on top of it for them too.
I'm wondering if the language issue comes up across multiple communities, and I mean, even as a grassroots organizer, it comes up all the time.
Mm-hmm.
And I'm just wondering if there's a way that we could, of course, now with the conditions that we're under, it's going to be even more difficult. But I was thinking if there were a way with the Democratic supermajority that unfortunately has not helped us with CalCare very much the last few years, could get behind some kind of incremental thing to dramatically increase the support for language justice work. It'd be nice to pay people that have the language skills, and give them employment that way. I don't know.
We are part of a lot of these language justice work groups within LA County Department of Public Health, as well as in the city of Los Angeles, and trying to make sure the county and the city have a language access plan, and each department head actually have some kind of plan that will ensure that their everything, all the materials, that their information, their resources, whatever they put out either online or on paper, are in the threshold languages. That is, the people who meet that threshold to be able to produce everything in that language, because they are at a certain size in population, right, to warrant that. And so we're part of all of these working group to demand that, because language access is a fundamental human right, civil rights. If you're unable to read anything that's out there because it's not in your language, then you have no access to that information. You have no idea, how critical it is, and it applies to you, and yet you can't access it, right? And it's life and death sometimes. And we've been part of attempts like PALS for Health, the Pacific Asian Language Services, had tried in the past to ensure language access through this language rights project where we would have people carrying a card that would be bilingual in English and in whatever that language is, like in our case in Thai, that they take to their healthcare providers that say that, I do not speak English and I need a medical interpreter, a certified medical interpreter in Thai. And that, if that's not provided to me and you are a healthcare provider that receives federal fund, that federal fund can be withheld from you if it's reported that a medical interpreter was not provided because it's a violation of the Civil Rights Act, of the U.S. And so we tried that, but what we found was that a lot of the Thai patients were too fearful to be that assertive, because then they feared that the medical professionals would then deny them healthcare because they were too assertive or forthcoming and too, so we were like, well, we want you to be assertive because you need to be able to assert your rights. But then they're like, well, but then they'll get offended and then they won't serve me. And I'm like, well, they have to because that's, they're obligated to, and that's their job. And they need to know that their job is on the line and their funding's on the line if they don't provide you with a certified medical interpreter. And then we also have done like the programming where we get a lot of the staff and volunteers at not just our agency, but other Thai community organization to go through like some medical interpreting training. That way you have a pool of people who are certified medical interpreters. A lot of Thais rely on like family members, even their own children. Imagine underage children.
Right. My mom had to do that with her Japanese-speaking parents. Same thing.
Right? Yeah, having to interpret, and because that's what I did when I was a child. I interpreted for my parents. I was like their advocate, right? And through the legal system, the school system, the healthcare system, and you get something wrong, that's life and death, right? And so life or death, and how could you and then some of it is too sensitive for a child to be interpreting.
Right.
Mm-hmm.
Well, we're kind of gonna probably have to wrap it up, and I'm probably gonna have to edit some a little bit, but wanted to get your thoughts on, I kind of mentioned before, we've had a Democratic supermajority in California. AB 1400 and AB 2200 were actually the two, I said, true single-payer bills in California because they were the first ones that closed that loophole that allowed for the insurance companies to still have their grubby hands on the public funds. And we got killed in committee both times, basically. And I don't want to get you in trouble, but do you have any thoughts about how we could somehow strengthen support for the legislators that are truly behind CalCare, so they feel safe to continue standing behind it and try to see if we can make more progress down the road? Do you have any thoughts about that?
Yeah, I think it requires mobilizing more of us to support, those more courageous, elected officials who are willing to support it and champion it, but they need to know that we have their backs too. So we need to really mobilize and let them know that we have their backs, and that if you surveyed Americans in the U.S., they majority want universal health care. Okay. Absolutely. It's just that you also have the lobbying power of the healthcare industry, who spend millions of dollars lobbying, these public office holders, and so until you get money out of politics, you're just going to have a hard time. But there's people power, and we need to be able to, to bring people together to really fight, because and you could also, make the Democrats realize that maybe this two-party system is not working. Maybe we need yet another party, right? People have got to get behind that notion that a duopoly is not working. It's like good cop, bad cop. It's just like, the Democrats are, are leaving the working class behind. They've not stood up for the working class and protected the working class. So now look what you have, right? You have people in power who speak, like they're populists, but they're not. They're authoritarians and tyrants, and it's become like a kleptocracy and corporate cronyism and oligopoly, but yeah, the Democrats, I don't know how they're going to survive if they're not paying attention to the working class and the people they're supposed to be representing. I mean, we need to think of also, maybe supporting yet another party.
I mean, I think a lot of people that they lost through this last stretch with, of course, the genocide in Palestine, I think a lot of people, they're not going to come back.
And, but I think I still believe in people power. I still believe in like grassroots organizing. I still believe in mobilization. I still believe of people and getting people out there to make waves and to fight the power and do whatever it takes to resist and to show that we take a stand. We're not going to stand for anything that's going to hurt the working class, the working poor, and that's going to fundamentally like transfer wealth from below to people above, and that's what's happening. So I just we just need to organize. It's about organizing. That's what it comes down to.
Time to get our hands dirty in the work.
Yes, roll up our sleeves, get our hands dirty, and get in the trenches. That's what's going to take. It's people power. There's power in
absolutely
in the people, and people seem to discount that.
Chancee, thanks a lot for joining us today, all of your knowledge, expertise, and for all the tremendous work that you're doing with Thai CDC out there in the communities. Really appreciate you. Thank you very much for joining.
Well, thank you for having me.
We'll talk soon. I'd love to get a hold of that white paper that you were referencing.
Oh, sure. I could send that to you.
We could republish that on our website and things
Absolutely.
Like that. Okay.
Sure. I'll send that to you right now.
And make sure to let us know if there's like different volunteer opportunities. We'll help promote the health fair, things like that.
Yes, March 1st.
We follow your social accounts, so I presume we'll see stuff there too. So
great.
Okay.
Thank you.
Thank you very much.
Bye.
Bye.
Thank you. Bye.